Excited to have you here today. And I realize that as many times as we visited, I don't really know how to say your last name. So I'm hoping that you'll introduce yourself and tell us a little bit about your background.
So I'm Courtney Mascio. I'm an OT and a CLT, and I work for the Lipedema Foundation as their professional education manager. So prior to that, I was an occupational therapist for about 7 years. And then I also worked a little bit in industry before I came on with LF. And so I developed an interest in lymphatics and OT school. So I had a really great professor who was a CLT, and I also had the opportunity to shadow an OT and CLT in an outpatient lymphedema clinic while I was there. So I knew that I wanted to pursue the certification to become a lymphedema therapist after I graduated. So I knew pretty quickly. So I got my CLT certification a few months after graduating OT school, and then I started working with the lymphedema and lipedema population. So I was introduced briefly to lipedema in my CLT training, but I developed much more knowledge and experience in clinical practice over the next few years. So the thing I think that was most striking to me with the women that I was seeing who had lipedema was how profound of an impact that I could provide just by validating their experiences and their stories. So
Mhm.
most of them have been told for years that they were lying about what they ate or that they just needed to work harder at exercising. So being able to explain that lipedema is a chronic condition that's often resistant to diet and exercise, and it's something that definitely is not their fault, was so powerful. Um, there was just this wave of emotion, I feel like, that would come over these women because finally, someone was saying, I believe you, you're not crazy, this isn't in your head, your pain is real. And so it made my work with the population incredibly rewarding, and it's still a reason that I'm still really passionate about increasing awareness today.
Do you feel like when you were in your CLT training that you got adequate information about the difference between lymphedema and lipedema and what lipedema is, et cetera?
Not entirely. I think it was sort of kind of an afterthought. The
Mhm.
main focus was lymphedema and how to treat that. We were sort of told that you may see this in your practice, like this is what it is, but it wasn't covered so in depth that you were really totally comfortable, I think, when you came into the field.
Yeah.
Luckily, I had a really great mentor who had been working in the field for a really long time. And so she sort of filled in that gap of knowledge from my training course.
Yeah.
But I realized that some CLTs aren't that lucky where they don't have a mentor back in their clinic when they get done. So I think there's still a gap there.
Yeah, I agree. And I think that it's improving. It feels like
Mhm.
I talk to more and more CLTs who are getting more information about it, but it still doesn't feel like it's core curriculum in a CLT training. So I'm glad that
I
some of
agree.
us
And I
have.
think it would be really neat to do like an advanced course or an adjunct course that is like solely focused on lipedema. And so hopefully that'll come in the future. I think
I
it's really
know at least
important.
one of the schools is doing that. So that is fantastic.
Yeah, really exciting.
So I'm curious, to also just hear your description of lipedema. You started on that, but if you would
Mhm.
elaborate a little more, because I think some people listening might not really know what we're talking about.
Yeah, absolutely. So lipedema is a chronic medical condition. So it's going to be characterized by a symmetrical buildup of often painful adipose tissue or fat in the legs and sometimes arms and lower trunk, meaning the hips, buttocks, and lower abdomen. So the feet and hands are typically spared, and that sometimes leads to the appearance of a cuff at the wrist or the ankle. So lipedema texture often has a nodular or fibrotic texture, and it can be accompanied by edema or hypermobility. It's different from obesity and lymphedema, but it may co-occur. Um, so lipedema almost exclusively affects females, And women with lipedema often complain of pain, tenderness, and heaviness in the affected areas, easy bruising, fatigue, difficulty losing weight with nutritional interventions and exercise, very limited to no to elevating their limbs, use of diuretics or bariatric surgery. And it often starts or worsens at a time of hormonal change. So puberty, pregnancy, and menopause is usually when we see it come out.
Yeah. Yeah, it's so frustrating. I mean, I feel for my clients who are dealing with that because, as you pointed out earlier, often they've spent a long period of time sort of being invalidated and working with practitioners who are less familiar with this chronic condition. And the work of the foundation is really helping to try to alleviate that, to try to help provide more resources that can educate providers. And so I'm curious what you have learned as part of the foundation from the registry that patients have been entering into.
Yeah, absolutely. So the Lipedema Foundation has so many incredible resources. So not only for patients, but healthcare providers. So I encourage anybody who is either new to lipedema or even if you're someone who is familiar with it to visit the site. So the Lipedema Foundation Registry. So we created that in 2019. So it was designed to help the lipedema community, so affected individuals, families, clinicians, researchers. The goals of the registry were to learn more about lipedema, understand the barriers to diagnosis, better manage symptoms, assess quality of life impact, and develop new treatment approaches. So this registry is still open. We encourage people to go and join, and we're hoping that as more people complete the survey, that it's going to provide direction for what types of research we should fund next. So typically the survey takes about 60 minutes to complete. It's easiest to navigate on a computer or laptop. And it's important to note that people with and without lipedema are encouraged to join so that we have controls.
Mm.
So anybody that's interested in learning more about that, you can visit lipedema.org/registry, and that will take you right to the site and you can fill it out.
So people can really do a public service, whether or not they have
Absolutely.
lipedema, by filling out that information. And that's fantastic.
It's incredibly helpful for
Yeah.
sure.
Yeah. And then you've recently started another resource. I mean, I know you have tons of resources, but the
Yes.
one that you started recently is really exciting to me as a CLT
Yeah.
myself. Can you tell us more about that?
Yeah, absolutely. So that would be our provider directory. So that's also going to be, if you're on our website and you go under the resources tab, that's also going to be there. So it's a resource designed for people with lipedema, their healthcare providers, and the broader community to help find therapists who have identified that they treat lipedema in their clinical practice. So we were so excited to just launch this recently at FDRS. We already have 195 self-identified therapists who are treating lipedema, which is just incredible. So when patients are on this site, they can search for therapists within their state. They can see the credentials, contact information, the affiliated organization, and the types of treatments that the therapist offers. So for now, we're not including information like if the therapist or clinic accepts insurance or if it's cash-based only, and we don't provide information about if they have a wait list or if they're accepting new patients. So those things may come later down the road, but still it's a great place to start. So we encourage people to use this resource and then reach out to a therapist that's close to you. And we're hoping that it's going to help patients make more informed decisions regarding their care, and just take more effective action in managing and treating the condition. We want to make clear that we're not recommending any specific provider. So this is like you opted into this list. So it's nothing that we've created on just by picking, therapists on our own. We're also aware that it's a non-comprehensive list. So there's probably tons of therapists out there that are still doing really great work, but they haven't opted into our directory yet. Right now, the directory only includes therapists, but we envision that we're going to expand that out to different specialties. So including diagnosing clinicians and possibly surgeons. So anybody who is a healthcare provider, but not a therapist, and they're interested in joining, just sign up for our newsletter, and we're likely going to announce when we expand the directory next. You can do that at lipedema.org/contact-us to sign up for the newsletter. And I think the most exciting thing is that we've already gotten really great feedback from the field. And we've heard from some therapists that patients have already found them on the directory and reached out to start treatment, which is really awesome.
That's fantastic.
Yeah, really exciting.
And I'm glad to hear
Thank
that
you for joining.
Yeah, no, I was signed up the minute I heard
Yeah.
about it. So I'm very grateful. And my practice is fairly full, but I take great pride in being able to guide patients who contact me to other qualified therapists in my area. But there aren't enough of us. So, we need to, keep trying to rally the troops in this direction.
Absolutely.
And I'm really excited to hear that it will go to other medical providers, because I think that that is a need. I hear from the people I coach very frequently that there aren't physicians who understand their condition. So the more we can educate, and I know you have many educational materials on your platform as well, and that will help patients find those providers who are informed.
Yeah, absolutely. We're very excited about expanding out to different specialties. We recognize the need for having a list of providers that can offer a diagnosis is incredibly needed. So that's probably one of the directions that we're going to explore next. So yeah, we're really excited to start with therapists. They're one of the few specialties that get some education on lipedema, and they're often really the first provider who can tell a patient what's going on. So it was a conscious decision to start with them, but we're really excited to be able to expand it out too. But yeah, if you don't mind, I wanted to point to a few other resources that we have on our website that might be really helpful for patients. So again, this resources heading that's on the website, you're also going to find things like our Lipedema Foundation brochure. We have a patient bill of rights. We also have a patient self-advocacy guide. So that was designed to help patients no matter where they are in their care journey. We also have, which is a super important tool, it's called our Lipedema Foundation Legwork Clinical Study Finder. So this was designed to help connect people with lipedema to studies that are happening near them so that they can participate in research and again, just try to advance the field.
Yeah.
So even if you're a healthcare provider and your patient's like, hey, I want to participate in research, this, kind of compiles all of those studies in one place. You can, search what's close to you. We've also got a videos and CME page. We have our registry first look report. So this registry that we were kind of talking about earlier, we published a report in 2022, and it sort of looked at all of the data that we had collected from the first 521 surveys that were fully completed. So there are tons of insights about that patient data. You can see that there. And then next, I want to talk about the newest addition to our website, which is the For Clinicians section. Really great place for clinicians to start, again, if they're brand new to lipedema or they're already diagnosing and treating. So we have our Clinician's Guide to Lipedema. We recently launched this as well. So we had found that there was this gap in the field for patients who were seeking a diagnosis and clinicians who are comfortable diagnosing. So there was kind of this need for a really concise and credible kind of flyer that was geared towards clinicians that could possibly offer a diagnosis to patients. So that's how we created our clinician's guide. It's a one-page front and back flyer. It's going to legitimize lipedema as a real condition and hopefully empower clinicians to feel more confident when they're offering a diagnosis. We highlight common presentation, clinical diagnosis, medical coding, common treatments, a list of professionals that would be appropriate to refer a patient to after diagnosis. And of course, CLTs are on that list because I think some clinicians or diagnosing doctors may not know that that's probably one of the first places that a patient
Yeah.
should be referred to. We're really excited again to have already gotten really great feedback. We heard that patients are using this as an advocacy tool to educate their own doctors, and that therapists have been sharing it with their referring providers who may not know what lipedema is. I know sometimes as CLTs we get referrals for lymphedema, even though it may truly be lipedema. So this can really help just get more education to those providers so that they understand. If you would like copies of that, you can order those again on our contact us page. So we're really excited to be able to offer those for ordering now. Yeah, just really
Yeah, they're
excited.
beautiful. I've seen them and really helpful. And I've had a couple patients tell me that they were able to bring some of your materials to their primary care doctor and
Yeah.
be able to move forward with getting the diagnosis they were seeking. And that's such a fantastic benefit that your organization provides to the public.
Well,
Um,
this patient population, they're incredible advocates for themselves,
truly.
you know? And so I think just being able to provide them with those tools was really important.
Yeah, they've taught me so much, the patients that I've been coaching and treating. And I expect, I would assume that you have found, as I have, that working with this population is incredibly gratifying. It
Yeah,
people
absolutely.
get good benefits from our therapy and they let you know. So
Yeah, absolutely. I've been working with the population for, gosh, it's been a little over a decade now.
mhm.
So again, there's nothing like it, and it's just yeah, very rewarding work for
Yeah,
sure.
yeah, incredible community. So
Yep.
all these things, I feel like we've gone over so many things that are important for people to know about the foundation. Are there any
Mhm.
final thoughts that you wanted to share with us?
Yeah. So we've got some really exciting things that we're still working on this year. So one of the things that we're most excited about is that we're focusing efforts on growing biosample resources by supporting the first ever lipedema biorepository at Vanderbilt University Medical Center and establishing a separate biobank. So really, really excited about that. It's going to be just incredible for the research community and I think really advance the field. So we're very excited to be working on those things this year. We also hope to keep growing this therapist provider directory. And again, we're going to try to be expanding to other specialties. So stay tuned. That should be happening a little bit later this year, we hope. And then we also just want to continue to grow our relationships with professional medical organizations and other partners to increase clinical awareness. So please reach out to us if you're a healthcare provider and you're interested in educating others on lipedema, or if you're connected to a professional organization that we should be in contact with. We definitely want to hear from you. And you can reach us at clinicians@lipedema.org.
That's great. Well,
Yeah,
I'm excited that that registry is at Vanderbilt because I'm in Nashville and I
yes,
worked at Vanderbilt for many years, so I'm still very connected there, and I will look forward to figuring out how I can be of some support to that.
yeah,
But
absolutely.
either way, thank you for sharing all of this information, and I very much look forward to hearing more great things from the foundation and to continue to participate in my little way.
Yes, thank you so much for having me today. And yeah, we'll continue the conversation.
Thank you so much, Courtney.
Thanks.